Thanks for joining us for our presentation today. I'd like to start by going back to the basics. So, why do children use switches? For children with severe and multiple disabilities, successful switch use can have a significant impact on their ability to actively communicate and participate in curriculum learning activities. Switching can be a means of making active choices and clearly demonstrating understanding. So why do we want to assess switch use? Well, the acquisition of switching skills is a developmental process. The process of using a switch is complex and involves many different skills. Having clear information about where a child is at in this process is useful to guide further intervention and training to help them reach their full potential. When we assess switch use, we are trying to answer the following question. Is the child using the switch in a way that is appropriate for the goals of the activity? If the answer is no, then we want to know why. The reasons why can be varied. The PEO model looks at how the person or child, the environment, and the occupation interact in relation to function. For example, under the category of person are items such as vision, hearing, voluntary movement, self-care, seating and positioning, cognitive skills, interests and goals. Under environment, we consider the noise, the lighting, people assisting, other distractions and the amount of cueing. Under occupation of switching, we might consider the engagement. Does the occupation suit the child's skills? Is it fun? Is it motivating? What type of equipment are they using? What type of switch? How does it move and where is it positioned? As part of my honours research, I conducted a systematic review which revealed a lack of validated assessment tools to measure the switching skills of children with physical and multiple disabilities over time. 6 tools were reviewed as having some capability to assess a child's switching ability, each with their own benefits but overall lacking in validation and the capacity to assess a variety of switching skills. We'd like to share with you 3 different tools so you may compare the components of these tools with the Novita switch record form. The first tool is part of the Wisconsin Assistive Technology Initiative and provides the scorer the opportunity to mark the presence of skills and describe the child's ability. This assessment focuses on motor skills, such as fine motor skills, range of motion, muscle tone and reflexes, accuracy, fatigue, visual skills and types of equipment. The next tool is the Area Cooperative Education Services referral form, and this provides a checklist-style assessment where the presence or absence of skills can be recorded. This includes whether they are able to concentrate, follow directions, and have age-appropriate listening or eye contact skills. The last tool was developed similar to the form we are introducing today, as a response to a lack of assessment tools. The Switching and Associated Behavioural Response Schedule was developed by Lois Moyer, and it was developed to collect data for a study and therefore was not developed into a form to be used commercially. This tool lists a range of skills and requires the scorer to record the frequency of each behaviour observed. There are, of course, more assistive technology assessment tools. However, since grey literature was not included in my review, these were not included. I'll now hand you over to Annabelle.
Hello. I'd like to spend just a little bit of time talking through the rationale for why we decided to create what's become known as the Novita switch record form. I guess as an OT working in an assistive technology service, seeing clients myself and supporting other clinicians and educators to teach children switching skills, it became really obvious that we were all spending substantial time from our own point of views, from educators' point of view, and from the point of view of the child and the family, teaching switching to children. And I guess as a service, and for the sake of the children, we need to be able to justify spending the amount of time that we were spending on this important skill development. However, as Grace has been talking about, there's limited evidence out there for which switch training methods actually make the difference for children, particularly for two-switch training, although there are some options which most of us see as best practice in this area. Often we were observing that the process